Good evening, everyone. We listened to an introduction on research, why people do research, and why, as PGs, it's important for you. Now we move on to the next session, which is on how to frame a good research question. So, at the end of the session, I would expect you to be in a position to enumerate the attributes of this research question, list out what are the questions a research question should answer, and be able to formulate a good one. This we already heard in the previous session, that research is the scientific and systematic search for information on any specific topic. And there are umpteen reasons as to why people do research. One of it is, of course, to publish and get promotions, as it is now even the same situation in medical education, where we need to get publications to get a promotion. People also do research to make money, to become famous, to present in conferences and international seminars. So these are some of the reasons why people generally do research. Now, as for you would be wanting to do research work as part of your thesis, that is to get your MD MS degree. So there are different reasons as to why people do research, but my personal opinion is, whatever be the reason you do, whatever research work that you undertake, it should not be random and unnecessary. It should bring about some impact, some good to the community. Now, why is research question important? Why is it important that you frame a good research question? I shall explain this with an everyday example. Now, if we are planning to go on a vacation, let's say this corona episode entirely ends and one fine day we are back to the old normal, and we decide to go on a vacation, what is the first thing that you are going to decide on when you plan a vacation? Obviously, it is the destination. It is where exactly are you planning to go? Are you planning to go to Russia, or are you going to Spain, or is it Munnar, is it Goa, is it Thailand? Now, why is this destination important? Because only after you fix the destination, you can decide on what is the mode of travel you would undertake. Is it the flight mode, or is it by train, or is it travel by a ship or a cruise ship, whatever. And also you decide on the company you take along with you, that is your friend, or is it with family. Then you decide on the kind of clothes you have to pack or even shop, whether you need to go take your winter clothes, or whether it's your summer clothes, or is it your swimsuit. It all depends on the destination. So a research question is like that destination. Everything else in research revolves around the research question. The objective of your study, the design that you would adopt to do your research work, on whom you are going to do the research work, that is your study subjects. Whom are you going to select as your study subjects? Then the different statistical tests that you are going to apply to analyze the results. All this would depend upon the research question. So that is the crux of the whole research project. Coming to the different types of research questions, well, we can broadly classify it into descriptive, relational, and comparative research questions. Descriptive research questions are purely of describing kind. For example, I want to study the clinico-epidemiological profile of patients with COVID-19 admitted to the Thrissur Medical College Hospital. So that's purely a descriptive research question, because I'm just trying to describe the population with respect to the clinical profile and the epidemiological profile. Okay. A relational research question would be one wherein I'm trying to look at the relationship or the association between any two variables. Like, for example, I want to find out if there is any association between lung cancer and smoking. Is there any association between smoking and esophageal cancer? Or any association between travel to foreign countries and COVID-19? Something like that. So I'm trying to look at relationship between two variables or the association between two variables. That becomes a relational kind of research question. A comparative research question would be one wherein I'm trying to compare two groups with respect to certain variables. So my research question would be something like um, is the mean BP of females higher than that of males? Or is it that the mean BMI of females have a higher BMI when compared to the males? So I'm looking at gender and BMI, two variables, whether it is different in two groups. So that's a comparative kind of research question. Now, whatever be the kind of research question you decide to formulate, you have to undergo the following steps in finally narrowing it down to your question. So, first, you're going to choose the topic of interest. That is, in which area you would want to do your research in. For example, you are interested in diabetes. So your topic of interest would be diabetes mellitus. Then next is identify an idea within that topic which you would like to work on. In diabetes mellitus, well, there are different areas that you can work on. Could be type 1 diabetes, could be type 2 diabetes, could be regarding the risk factors for diabetes, could be regarding the prevalence of diabetes, could be about the complications of diabetes, then could be about self-care in diabetes, compliance to treatment, different modalities of treatment, different diagnostic tests. So many different aspects you can study within that topic of diabetes mellitus. So choose that idea whichever you are interested in. Then you read about it. So you read about that particular area of interest that you have, and then you can identify the gaps in knowledge. So which are the gray areas? Areas about which not much information is known to the scientific community. Identify those areas and see whether you can formulate a research question to answer those gray areas. So once you get the question in the crude form, then you try to operationalize the question. That is, see if it is possible for you to work up that question with regard to certain characteristics, which we will discuss in the next few slides. And then last of all, refine the question or fine-tune the question over several phases and finally get the most refined form of your research question. So once you identify the topic, as I said, you need to get the ideas. So how do you get your ideas, or where do you get your ideas from? Now, pure inspiration, well, that happens, but it's very rare. For example, you all know about Isaac Newton, who was like just resting or sitting under a tree, an apple fell on his head, and then that gave him the idea of putting forth the laws of gravitation. So such incidents are very rare. 99% of the time, you really have to put in an effort to get these ideas from. Could be by attending a conference or a seminar, listening to other researchers, discussing with them so you know where are the areas people really need inputs on. The critical reading of published papers or journals, so that gives you an idea about the current level of knowledge regarding your area of interest. Then, of course, observing your patients in the wards. That itself is a lot of clinical material for you. Then sometimes you have a colleague who's like very inquisitive, very curious, and keeps asking weird questions. Sometimes this weird question itself could probably provoke an idea in you and prompt you to do research on that. So that's a possibility. The new technologies bring in new questions. Yes. Now let's take the example of the online classes. Now this is the first time we're organizing an online workshop for research methodology for the PG. So it's a new technology, a new method of teaching that we have tried, and that would definitely raise some research ideas. Now, is online teaching good enough for the PGs? What is the perception of online teaching for the faculty members? What is the perception of students regarding these online modes of teaching? Which is better, the online teaching method or the traditional live classes? So such kind of new research questions pop up with new technologies. So these are some of the ways in which you can get some ideas. Now once the idea is identified, then as I said, get the question. So how you get the question? As I said, know the current state of knowledge regarding that particular area of interest. Read about it and identify the gaps or the gray areas, which are the uncertainty areas, which needs some inputs, which needs to be worked on. That gaps have to be identified by you. So frame a research question to identify, to address those gaps. Framing the right question can definitely be a challenge. Now, in the process of formulating a good research question, we have a very important step called the operationalizing a research question. What does that mean? It means striking the right balance between idea and feasibility. All of us have wonderful ideas, great ideas when it comes to doing research. But how much of this idea is actually workable or feasible? How much of it is actually possible for you to do? That is important. So that's what I mean by saying striking the right balance between idea and feasibility. Idea should always be novel, interesting, and relevant, but at the same time, it should also be workable or feasible. It should be ethical and should have an impact on the society. Okay. So let us look at the characteristics of a good research question. Now we usually use this acronym FINA to remember the characteristics of a good research question. F stands for feasible, I interesting, N novel, E ethical, R relevant. Let's take each one in detail. What do you mean by feasibility? Feasibility means, can I do it? Is it possible? A study on mental depression among war victims. Look at this research question. It's a very good idea. Very relevant. Mental depression, yes, a big problem. But it's mental depression among war victims. Can you as a PG student in Kerala do this topic presently? No. Where exactly do you find your war victims? You might have to travel to some war affected zones to be doing the study, which is highly not feasible at this moment. Then, whenever you decide on a study, look at whether it is feasible with respect to the time you have at your disposal. Now, you are doing your PG thesis, you have a maximum, let us say, 1 to 1.5 years of time to do it. So, is that study you choose having does it stick to the time frame? Can you finish it in the time frame? Is it feasible with respect to the amount of resources, money, materials you have? Is it feasible with respect to the expertise you and your guide has? And feasibility with respect to sample size. For example, you choose a topic and once you calculate the sample size, it's like you need some 1,000 individuals and it is not possible for you to get it within the time frame of 1.5 years for your thesis, then obviously it is not feasible with respect to the sample size. Then I stands for interesting. So your research work or your research question itself should be interesting. Interesting not just to the researcher, it should also be interesting to the readers. Because finally when you publish it, the scientific community should be interested in it also. So these two aspects are important, but I would say most importantly it should be of interest to the researcher, because you need to hold up this interest till the end so that you end up completing your project at least. Coming to novelty, N stands for novelty. Novelty means new. As far as possible, don't try to reinvent the wheel. Don't try to find out something which somebody else has already discovered. Always try to work on new areas, new topics. But most of the time, it may not be possible for you to work on an entirely new topic, because somebody else would have done some or the other work on most of the topics. So always look at providing some new findings to existing worked up topics. Maybe you can use a better study design and do a more stronger study and either confirm or refute findings of previous studies. Or maybe you can add on to the findings that some other researcher has already got. So something new. Maybe you can repeat the study in a new population or in a different age group or in a different setting altogether. Maybe the findings would be slightly different. So some novelty could be brought into the topic even if the entire topic is not new. Then E stands for ethical. Ethical means, is the research question ethical? Would you find it objectionable if you or your loved ones were the study subjects? That is, if you were asked to participate in the study, would you gladly, happily enroll in the study, or will you think twice? If you are having your own doubts about joining such a study, that means the study is definitely unethical. There's some problem. So we intend that there should be no harm being caused to the patient, to the participant, when participating in the study. And when a research work is done, we say you always have to get the consent and maintain confidentiality, etc. And all the ethical aspects should be looked into. And that's a separate session altogether. But here we're just looking at whether the research question is ethical. Coming to the relevance. Is the research question relevant? Is it of importance here and now? Look at this. Study on yellow fever in Kerala. Now, this is a good topic, but is it relevant in Kerala currently? No, because we don't even have yellow fever here. Then what are you going to study on that? But look at the second one. Study on dengue fever in Kerala. Is that a relevant one? Yes, of course it is relevant, because we are having a lot of cases of dengue. We really need to study about this topic. So that's a relevant topic. So relevance to scientific knowledge, relevance to clinical and health policy, and relevance to future research directions have to be looked into before you finalize a question. So we looked at the attributes of the research question. It should fit into the finer criteria. Then once you have framed a question which satisfies all this, then you try to refine it in several steps. You can't just refine one single step. You need to do it multiple number of times to get the final refined question. So the question should have all these included. What is it that you're studying? That is your study topic. On whom are you doing the study? That is, who are your study subjects? Where exactly are you doing the study? The setting. How are you planning to do? That's the design you're adopting. When you're planning to do this, your study period. And of course, why you want to do this study, or why this research question has been chosen. That would come under the background and rationale, the reason as to why you have decided on this topic. But that may not be put up in the question. The why part, you can put it in the introduction or the background and rationale part of your project. All the other headings or all the other questions, what, who, where, how, and when, should be part of your research question. Okay. So you get the topic, zero in down on the idea, identify the gaps and frame a research question in that, and then see whether it fits into the finer criteria, that is, all those 5 attributes are satisfied. Then go to refining your crude question through multiple steps. So let's take a few examples and see how this is done. Now, let us say I've been working in Thrissur for like 6 years now, and I've been interested in esophageal cancer right from the beginning. And in Thrissur, I made this observation that there are a lot of cases of esophageal cancer coming to the surgery department and radiotherapy department and all that. So I begin to wonder if there is a high incidence of esophageal cancer in Thrissur. And I also see a very large queue, not large, long queue in front of the Beverages Corporation, also in Thrissur. So I begin to wonder if consumption of alcohol is a cause for this high incidence of esophageal cancer. So that's the idea I have. And I read more about this problem, and then I frame a question on what are the risk factors of esophageal cancer in Thrissur. Now, it's a relevant question, yes, because it's the problem in Thrissur as such. Then it is feasible. I can work on it. I can do a study and find out the risk factors. It's going to have an impact on the community because it's going to finally tell me what are the factors that somebody has to avoid so as to prevent oneself from getting esophageal cancer. Then it's also an interesting topic to me, so it's fitting into all the finer criteria. Next, I go on to refine the research question. So I refine it by adding a few points because the question was very crude. Just risk factors. What is it that I'm studying? Risk factors of esophageal cancer. That's the only thing that's mentioned, and the place in broad terms is Thrissur. So I'll have to add a little more specificity on the what. Then I have to add on whom I am doing. So my study subjects, I have to add what is the design probably I'm trying to adopt. All those aspects I have to incorporate into this question. So the refining would give me a better question. What are the risk factors for squamous cell cancer of esophagus? So CA esophagus, I've made it a slightly more specific term, squamous cell carcinoma of esophagus, in patients admitted to Government Medical College, Thrissur. So the study setting has become more clear as compared to age and sex matched controls from surgery wards of same hospital. So I'm trying to compare it with another group who are not having CA, who do not have gastrointestinal malignancy, admitted in the same hospital. So let us see whether it addresses all these questions. What is it that you're studying? Squamous cell cancer of esophagus. Who are you studying, or who are your subjects? You have cases and controls here. So patients admitted with esophageal CA, and then you have age and sex match controls who don't have GI malignancy. So those are your study subjects. Where you're doing the study is Medical College, Thrissur. How you're doing it? Of course, since you have age matched controls, obviously this is a case control design. So all these aspects are quite clear from the research question. Probably have to just add the time duration of the study period when I'm planning to do this study to make it complete. Coming to the next example, let us say I'm interested to find about the association or relation between physical activity and cardiovascular disease. So that's the topic I've identified. The research areas, is there any link between physical activity and cardiovascular disease? So my question of interest would be, will 30 minutes of moderate activity reduce hypertension in office workers in Kerala? So here what I am aiming at is, I have a research hypothesis in which I feel that 30 minutes of daily activity in sedentary people will reduce the systolic BP by 10 millimeter of mercury. So that's the research hypothesis I have, and to prove that I'm taking up the research question that 30 minutes of moderate activity would reduce hypertension in sedentary workers. So refining the question, I could make it a bit better by saying, will 30 minutes of moderate exercise done for at least 5 days a week for 6 months. So I'm specifying the amount of exercise, for how long, for how many days, for how long, the duration, reduce the blood pressure by at least 10 millimeter of mercury. So it brings about a reduction in BP is quite non-specific. By how much millimeter of mercury is going to be the reduction, that I have specified. So making it a more specific question. On whom I am doing it? Among 250 hypertensive office workers in Kerala. So this is the better version of the crude research question. Now, besides the terminology research question, objectives is another terminology that we need to mention in our protocol. Sometimes the research question alone would be sufficient. Certain people would just mention the objective, some write both. Okay. So ideally, objective is just the same as research question. Only thing, when you state it in the form of a statement, it becomes objectives, and when you say it in the form of a question, it's a research question. So it's basically the same thing. Objectives can be either primary objective or secondary objective. Primary objective is the one which is the main objective you are interested in studying. For example, to estimate prevalence of obesity among all females aged 35 years and above in a selected ward of a particular panchayat. So here my main objective is just to estimate the prevalence of obesity among females. Okay, so my entire design, study design, the sample I choose, the sample size I calculate would all depend upon this primary objective. So that is why it is the most important objective or the primary objective. Now, when I'm doing this study or when I'm trying to find the answer to this primary objective, it is possible that if I add a few more questions and collect a little bit of more information, I will be able to satisfy one or two more objectives. So that becomes my secondary objective. It's the additional information that I'm going to get in the process of satisfying my primary objective. You can collect that information as a secondary objective. For example, in the study I mentioned before, to study the prevalence of obesity, I can also study the distribution of obesity in terms of socio-demographic factors like age, education, marital status, occupation, etc. Because I'm already collecting information about the obesity part. In addition to that, some basic socio-demographic details like the age, gender, gender is already female, so age, education, occupation, marital status, etc. I'm also collecting, so I can always see how obesity is distributed among these groups. Okay, so that's a secondary objective. To determine the potential risk factors for obesity by adding one or two questions on the diet and exercise pattern and all that, I can probably assess some amount of risk factors also of obesity. So these are the additional information which I can collect as part of satisfying my primary objective. So those are the secondary objectives. So the primary is the most important one. So the design, the sample size, everything would depend on the primary objective. Usually you can just have one or two primary objectives, that's fine, or you can have one primary and one or two secondary objectives. It's not always mandatory you need to have secondary objective. One primary objective itself may be enough. Don't go about writing 4 or 5 secondary objectives in addition to a primary objective. That will be like so many objectives and difficult for you to satisfy. The maximum one primary and one or two secondary would be sufficient. Okay. Objective, just like the research question, objective should be SMART objective. What do you mean by SMART? This is another acronym. S for specific, M for measurable, A attainable, R realistic, and T time bound. Let us see what is specific. An objective should be specific. Now from this, to explain this, I would just borrow an example from our principal. Sir had used this example when he took a research methodology class for the undergraduates. So what Sir said was, now after you finish your undergraduate course, obviously you'll be praying to God for a PG seat, okay? So you can be like, God, please give me a PG seat. So you're very non-specific in this request because you're not specifying the subject in which you want and not even the college in which you want admission. So you may get probably, let us say, a PG in, let's say, anatomy in Rajasthan. Okay, so if you were very specific in your demands, how would you have prayed? Please, Lord, I would want a PG seat in dermatology in Thrissur Medical College. So that makes it very specific. Which subject, which college. So same way, your objective should also be very specific. It should clearly specify what it is that you are trying to find out and how you are planning to measure it. That is, your objective should be measurable. You should be able to quantify it and find an answer to it finally in the end. That is attainable. It should be realistic one, and it should be time bound. That is, you should be able to achieve your objective or find the answer to your objective within the time allotted to you. So to summarize what we have read, we learnt about the attributes of a good research question, the finer criteria, and also how we can go about refining the question. Now, a good researcher is one who actually makes a good observation, and then based on this observation an idea is born in his mind, and from that a research question pops up. Then he tries to find an answer to that by doing the research work, and from that answers again new questions come up, and then he continues his research. So it's something like a vicious cycle. So to conclude, a right question with the right methodology would definitely provide you with the right answer. So this session would be the end of an important beginning to your research work. Now I have a few more slides on examples of research questions. Maybe since time permits, we can go through those also. Look at this question. Does bed rest for 6 weeks reduce the risk of recurrence of pain within 1 year in adult patients younger than 50 years with acute low back pain of less than 6 weeks duration as compared to a similar group of physiotherapy? So here, what is the intervention you are looking at? You are going to see if bed rest for 6 weeks is going to reduce the risk of recurrence of pain within 1 year. In who is a study population? In patients with low backache, acute low backache of less than 6 weeks duration and who are less than 50 years of age. So that is the study population. And you have another comparison group wherein they are also having acute low backache of less than 6 weeks duration and less than 50 years of age, but they are undergoing physiotherapy. So one group is getting bed rest for 6 weeks, the other group is getting physiotherapy. Okay, so that's the intervention you're looking at. Patient population is also mentioned, and the comparison group here is also mentioned. What is the outcome you're looking at? Whether there's going to be a reduction in the risk of recurrence of pain within 1 year. So that's the PICO criteria. P stands for the population, study population. I stands for the intervention you're planning to do. C is the comparison group, whether it has been mentioned, and O is the outcome. What is the outcome you are looking at? So PICO criteria also can be taken as one criteria for seeing whether the research question is a good one. So finer criteria and PICO criteria. Okay. Look at this. Should women take hormones to prevent bone loss? This is a very crude question. Hormones and bone loss. Is there some relation? Okay. So is taking estrogen associated with a lower risk of osteoporosis in women more than 60? So that is a slightly more refined version. We can still make it better by specifying the dose of estrogen, then having a comparison group. So does taking estrogen, specify the dose, after menopause reduce the likelihood of bone density loss in women over 60 years compared to women not taking estrogen? So that makes the question better. So initially the question was, should women take hormones to prevent bone loss? Then which hormone you're specifying, the dose of the hormone you're specifying. Then women, you're narrowing it down or classifying the women into the specific age group that you're looking at. That is those who have undergone menopause and who are more than 60 years. And what is it that you're looking at? How are you going to assess the osteoporosis? By bone density loss. So you've specified things and made the question a better one. Look at this one. Can a veg diet reverse cardiovascular disease? So veg diet, it's quite non-specific. How do you make it more clearer? Does a plant-based diet. Okay, that's one way to make better. Cardiovascular disease. What aspect of cardiovascular disease are you trying to reverse here? So does a plant-based diet reduce serum cholesterol levels in patients with cardiovascular disease? So again, you're trying to make it better. How much of blood cholesterol level reduction you are expecting? So does an entirely plant-based veg diet reduce blood serum cholesterol levels in men over 50 years of age with lipid levels more than 250 milligram per cent as compared to a meat-based diet? So when you refine further, probably you can add on more points and make the question a better one. Are anticoagulants useful in patients who have had a stroke? Now look at this question. Anticoagulants and patients with stroke. So what is it that you're looking at? Anticoagulant use in stroke patient. Does it improve the outcome? So your PICO group here would be your PICO. The patient group would be patients with acute ischemic stroke. And you have a comparison group here. Yes, that is patients with acute ischemic stroke who have not taken any treatment. The intervention here is you're giving anticoagulant to the population, study population. So you have a population mentioned, you have the intervention, you have a comparison group, and what is the outcome you're looking at? Is there an improved outcome for the stroke patients? So do anticoagulant agents improve outcomes in patients with acute ischemic stroke compared with no treatment? Okay. So These are the two important criteria which you have to see your research question answers. So these two criteria, PICO and FINA criteria, you please keep in mind so that you can check whether the research question you frame has all these components. Okay. So specifying the population, the intervention, the comparison group, the outcome. Then is this research question feasible, interesting, novel, ethical, and relevant? Okay. So thank you all for the patient listening, and please remember that being logical will get you from A to Z, but imagination will get you everywhere. So in research, you would need an optimum mix of both logic and imagination. Thank you. Thank you very much.